Hello. Have you had any worsening symptoms of cough or shortness of breath or sore throat? Have you been around anybody that's had COVID-19? No? Let me just take your tab and we'll get you checked in and get you a mask to put on, okay?
All right, I'm going to shake your hand. Congratulations, Dr. Eagle. There you go. And congratulations, Dr. Cardinal.
Hi guys, I'm Molly with the Respiratory Therapy Department here at Hancock County Health System in Britt, Iowa. And I am actually practicing social distancing today. So because of that, and it make it easier for you guys to understand me, I'm going to take my mask off. So what we're kind of doing today is I'm going to be talking to you, since I'm a respiratory therapist, I'm going to kind of be talking to you about what a respiratory therapist is and what I kind of do in my job. So, does anybody know what being a respiratory therapist means? Think about that for a second. Did anybody guess? If you guys guessed that I deal with the lungs, you are totally right. Because that is what my job is my job is to help people breathe easier. So in my department, we do lots of different tests that help determine on how someone is breathing, if they need some type of medication to help them breathe better, and we also do some rehabilitation with people. Does anybody know what rehabilitation means? Think about it. If you guys guessed it has to do with exercise, you are totally right. What we do with patients that maybe have some breathing issues that have been caused by lots of different things. Sometimes it can be smoking, sometimes it can be that their lungs were damaged by some type of chemical, or just that they have just some issues going on with their lungs. The rehabilitation that we do, we exercise our patients and we try to build those lungs back up to help them breathe easier, okay? So with that, I wanted to kind of show you a little bit about what our lungs look like, okay? So our lungs are actually located in your chest, okay? So if you kind of follow your neck down all the way, that's where those lungs have a tendency to sit, okay? So that's a good thing, and we like those lungs to be nice and pink. Sometimes with our patients that we see come in after they maybe have been smoking for years or so, we have a tendency to kind of see some yucky lungs sometimes. If you can kind of see that on this side over here, we have nice healthy looking lungs, okay? They're a light color, not much darkness to them, and over here we have some smoker lungs that have some tar and some black, really bad carcinogens that they kind of took on over the years when they were smoking. So one thing to remember to take away from the video today is smoking is not good for us. So you need to take care of those lungs and keep them as healthy as you possibly can, okay? One thing to do about keeping those lungs healthy, and the same type of thing that we do for rehabilitation, is we exercise. That helps keep us really, really healthy and makes everything work the way that it's supposed to. One thing with the exercise that we also do for patients is we do cardiac rehabilitation. That cardiac rehabilitation is about hearts. Does everybody know where their heart is located in their chest? It's located in those ribs by the lungs, kind of right in the middle, okay? So we also do rehabilitation for patients that maybe have had a heart attack, or they've got something going on that they really, really need to get that heart back in ship shape. So we exercise those patients, okay? So we do lots of cool stuff, kind of fun stuff, and just try to help people make it a little bit easier to breathe and a little bit easier to do things by rehabilitating that heart. So I'm going to show you a couple little things to do that you can do at home that are fun. If you've got brothers, sister, mom, dad, grandma, grandpa, aunts, uncles, something like that, you can grab a simple little straw at home and a cotton ball. These are things that everybody usually normally has at home, okay? So what I'm going to show you guys to do is you can actually have cotton ball races. And the reason I kind of have this fun little game to show you is because with a straw, I'm going to kind of have you guys do this at home because you guys will get those straws and the cotton balls in your little baggies. With that straw, what I want you to do is I want you to put the straw in your mouth and I want you to plug your nose, kind of like this, okay? Now, if you just did that, you're going to notice it was kind of hard to breathe, wasn't it? It was, yeah. So when somebody has a straw in their mouth and you plug off your nose so that you can only breathe through that straw, that's kind of what it feels like for somebody that has what's called COPD, chronic obstructive pulmonary disease, on how that feels for them to breathe. They're short of breath a lot. They have to work really hard to get that breath in. So that's something that you can kind of compare to what it feels like to have COPD, okay? So here's the fun game with it. Grab that cotton ball and that straw that you got, okay? And what you're gonna do is, if I can turn my table so you can kind of see it a little bit easier, you can get on the edge of a table, okay? And have mom, dad, brother, sister, whoever over on the side, and let them have a straw and a cotton ball too, and you guys can have cotton ball races. So you start 1, 2, 3, and whoever gets their cotton ball that they've got the most breath to blow it across the table wins. You can do this all kinds of stuff, and it's really good because it exercises those lungs. You're stressing those lungs to make them work hard for it, okay? So here's how you kind of do it. Just like that, okay? So pretty fun little thing to do at home. So when you guys get those cotton balls and the little straws, you guys can do that too, okay? All right, and then one last little thing I'm going to show you before I'm done here today is I'm going to show you one thing that we do with pulmonary rehab with our patients, okay? So everybody usually has bubbles at home, right? It's summertime, you guys are out of school, it's going to be really fun, it's going to be hot out. Grab some bubbles, okay? I actually get to work with bubbles with my patients. One thing that we teach our patients to do is controlled breathing, okay? So when somebody gets short of breath, the first thing that we want to do is we hump over and bend over and we start huffing and puffing, just like where you guys are running outside at recess, right? Well, what we really should be doing is we should be sitting straight up, allowing those lungs to really get some good expansion and focus on your controlled breathing, okay? So here's how I show my patients when we get to blow bubbles during rehab. Controlled breath, you want to try to get the biggest bubble you possibly can. That's going to control the amount of air that you put into that bubble, and you kind of have to hold it there. Sometimes I'm good at this, sometimes I'm not, so you guys will have to be the judge, okay? So did you see how big my bubble was and how I was able to kind of keep it there for a while? That's called breath control. And we work really, really hard with patients to make sure that they control their breathing so that they don't get short of breath, or when they do, they can kind of help recover with it faster. Okay? So go get outside, have some fun this summer. School's out. Blow some bubbles, breathe through those straws, and have some cotton ball races and have fun. And play safe and have a very happy summer. Thanks, guys.
Hello, my name's Dawn. I'm one of the physical therapists here at the Hancock County Health Systems, and my job as a physical therapist is I'm kind of like a movements expert, because we get people moving in my job, where we try to make them stronger by having them move and do things. We get their muscles stronger, their heart and lungs stronger by getting people moving. We also work on their balance so they're stronger and don't fall as easy. One of the benefits of being stronger and keeping yourself active is that if you're stronger, your heart and lungs are in better shape, you're a better athlete. You can run faster than anybody, you can jump higher, you can kick the ball farther, you can even throw the ball farther. So it's important that we keep ourselves active. So that is one of the things we're going to be doing here this afternoon or morning. And one of the other things that we're going to do is part of being healthy and staying active is maybe knowing how to take our heart rate, because one of the things exercise does, it improves our heart and lungs so that our heart doesn't have to work as fast. So how we do that is, if everybody can, I want you to take one hand kind of on the outside of your wrist closest to your thumb there. I want you to kind of feel around a little bit, and what we're looking for is we're looking to see if you can kind of feel like a little pulsating. That's kind of your heart beating the blood through your body. So I want everybody to kind of poke around a little bit, see if you can kind of feel your heart rate there a little bit. And then what I'm going to have you do while you're feeling that is, I want maybe someone can watch the clock for me, and for 30 seconds we're going to time how many times you can feel that beating of your heart. So I want everybody to find their pulse, and then my clock teller tell me when we're ready to go.
Dawn, can you put your arm down so you can see where you're touching? And talk to us about where you're at between your ligaments or
Okay.
whatever.
Where you find your pulse is kind of closest to your thumb here, and then come in a little bit above where your wrist is bending. On the side there is kind of where you're going to feel it. If you can't feel it, feel free to kind of move around a little bit until you do feel something. You don't need to press real hard. It's kind of a light touch. You should be able to feel that kind of that pulsing or the beating.
Perfect. Okay.
All right.
Thank you.
Is everybody ready to start counting? Go. And stop. Okay, I want everybody to remember that number, because what we're going to do, like say I counted maybe 40 times my heart was beating in that 30 seconds, we need to double it. So 40 plus 40 would be 80, so that would be our beats per minute that your heart is pumping. So if everybody can take the number they had and double it, that's what your heart rate is. I want you guys to remember that number, because we're going to get ourselves moving a little bit. And then we're going to take it again after we've done some exercise and see what happens to our heart rate. Can anybody guess? Is it going to go up or down if we get moving? You guys know? We'll find out. Okay. You guys ready? These are my my lovely patients here that are going to help me get moving this afternoon. So I want you guys to follow along with us. See if you can keep up with these two. All right. So we're just going to kind of walk in place. We're going to kind of do a little warm up a little bit, kind of march. You can march slow or you can march real fast, whatever way you want. Then let's be a little wacky. Let's go out to the side a little bit. Move those legs out. Let's see which one of these guys can lift up the highest. All right, now let's start kicking our butts a little bit. Can you kick your butt? All right, this is all fun stuff you guys can do every day. Get outside, play, run around, be goofy. Okay. All right, how about we do a few jumping jacks? Everybody knows how to do jumping jacks, so let's go. Okay, good. Oops, lost one. Put that over here for you so we don't step on it. Okay. Now let's try some squats. Let's see if we can squat down, back up, squat down, back up. There you go. Okay, good. How about we try some marches? We're going to try to lift one leg in the opposite arm. Just kind of get yourself moving. See if we march in place there. Or if you got more room, you guys can be marching around the room.
So Dawn, should we get up and try this at home?
Yes, this will be fun things to do every day. Invite your friends over, pick on your siblings. Okay, how about we do a little bit of side shuffling? We'll try to kind of squat down a little bit and then try to move sideways. Anybody play basketball? This would be a good defender move. Works those legs. Okay. All right. Next we'll try a few little, we call them monster walks here in therapy. Try to take big steps. Go forward, taking big steps. Then we're gonna go backwards. Try to take as big a step as you can. Oops. Without running into things. And forward again. And backwards again. Okay. All right. How are you guys doing? All right? Should we check our pulses again and see if we increased or decreased, and we'll find out our answer? All right, I want everybody to find their pulse again. So again, by your thumb, side of your wrist there, kind of come up, and our timer says start counting. And stop. That was 30 seconds. So did your number increase or decrease? Was it going up? Up, okay. That means we got our hearts and lungs working, doing that. So, and then the more we exercise, a lot of times the more active you are, your heart and lungs get stronger, that pulse rate will go down when you do a bunch of stuff. So the important part is to stay healthy, stay active, and have a great day.
All right, so today we're going to do a demonstration on germs and how germs spread. So what I have here is a plate in the middle here with flour and some toys. So if I put my hand in the flour and then our eagle puts his hands in the flour, then if we touch toys, you will see how the germs are spreading and how we're spreading germs to each other, how we're spreading to our toys. So if I put, my hands aren't, anyhow. You can see my germs. And then let's see if the eagle has any germs. So at this point you can see we have spread germs to this toy, this toy, this toy, and this toy, and also on my hands. So if I were to wash my hands, then you wouldn't see the germs because I would have cleaned all these off. So we wouldn't be transferring germs that way. So that is why we should wash our hands to prevent the spread of germs. So.
Hello, I am Bonnie Wilhite. I am in charge of the surgery department at Hancock County Health System. Welcome to our beautiful facility. We have just moved up here in January of this year. So we're very excited to be up in this new area. It has given us better room, more room. It's given us bigger area to do more procedures. It's more private, so our patients really appreciate that, because in our old area it was really hard to social distance, and that's exactly why I took my mask off, because we're able to do that up here. And so it's nice to have our beautiful area. I'm gonna walk around and kind of show you our beautiful area. So this is one of our same-day surgery rooms. And the kind of surgeries that you guys would be familiar with would probably be like a tonsil or ear tubes, or sometimes we take out people's appendix if it's infected. So those are 3 procedures that you may be familiar with. So this is called our same-day surgery room. This is, we get our patients off the elevator, and you would come up with your mom or your dad, and you would come in here and have a seat in the chair, and we would talk about what we're going to do. We would tell you, you know, what to kind of expect for the day, and we would take your vitals. So we would take your blood pressure. I don't know if you've ever had your blood pressure taken. It's like pumping up your muscles to see what your blood pressure is. We would take your temperature. We would either take it in the ear, but we now have another thermometer that takes it across your forehead. So you might be able to have it done that way. And then we would have your mom or dad sign paperwork. We would explain the paperwork, what to expect for the procedure, and then we would have someone sign that for you. And then we would talk a little bit about how you're going to go back into the other area and get put to sleep so we could get the procedure done. Our anesthesia person is the person that would put you to sleep. So he would come in and visit with you beforehand too. And also the surgeon, the guy or female doing the procedure would come in and talk to you before the procedure also. And then we would walk back into this big surgery area here, and this is called our sterile area. And with it being sterile means that there's no germs back there, or very few germs. And so we aren't going to walk back there today just because it's all clean and nice and sterile. And sterile means no germs are growing back there, so we want to keep it that way because we don't want anybody to get an infection. For your procedure, we will take you back into the sterile area, and we would put you in one of the surgical suites. There's 2 big rooms back there. One of them we would take you into. And when you walk in, it is a lot of things. So you would notice there would be big lights on the ceiling. Those look kind of scary, but we need to know, and we need to see what we're doing when we're working on you. And then it would be really cold back there. So we have these really nice warm blankets that we keep in a warmer that we would give you to keep you nice and warm during the procedure. And then our anesthesia person will give you some medicine to make you sleep so you won't even know what's going on back in the procedure room. And then after the procedure, we would bring you back out, and you would go back into the room that you started in, and we would watch you and make sure you wake up okay. Now, if for some reason you don't feel good after your procedure, you just would need to tell us, and we would go ahead and give you some medicine, and that would make you feel better. And then once you're feeling good and we know you're doing okay, then you can go home with your parent or guardian.
You should have received something like a rainbow with a bunch of holes, some string, and a small needle. So for this activity, you're going to thread the needle with your favorite color string, and you can pick any of the colors, and they don't matter which ones go where. So you're going to thread it, and then you're going to kind of sew. This kind of shows us how doctors sometimes do the stitching in surgery. And you're just going to stitch through the holes, stitch through the holes. And sometimes it's easier if you go opposite ways. Then you can kind of make those X's. Before you do the stitching, you can color the rainbow or the sun, whatever colors you want. But see, that's how you do that. And then you might need a parent's help, or maybe you can do it yourself with the scissors. And you can just cut the string there and tie it on this side. So kind of tie it in a knot to kind of close that off. And then you did your stitch. Then you can pick another color and kind of pull that out of your kind of messy strings and start at the bottom and work your way through. This one's a different type of stitch. So it's not the X's, but it's just going over. And if you want to go back and then just finish up stitching your entire rainbow and you're done.
Hi boys and girls, I'm Stephanie. I'm the health coach. I'm a registered nurse here at Hancock County Health Systems. Today we're going to focus on washing hands and germs. I'm not wearing my mask today because we're practicing social distancing. So you're going to see me do a little presentation about washing hands and germs. So we're going to go into our room. Okay, so first off, we want to talk about germs. What are germs? Germs are things that live in our environment that are small, not being able to be seen by the human eye. They can make you sick, and so we want to try to get rid of as many of the bad germs as we can so that we can stay healthy. So some of the times when you should wash your hands are when you play outside. So after you come in from playing outside, anytime that you are going to do something after you play outside, then you need to wash your hands. Anytime that you play with one of your pets. So if you're playing tug of war with your dog or your cat, or you know you're playing with with any pets, birds or anything, wash your hands after you're done. Anytime you eat or drink anything. So I've got my apple here, and before I would eat it, I would want to wash my hands. The most important is a lot of kids know that you should always wash your hands after you use the restroom. So you would always want to wash your hands for at least 20 seconds with nice warm water, making sure to get under your nails and around your nails and in those cracks and creases. So after you use the restroom. So we're going to move over to the sink, and I'm going to show you the proper technique on how to wash your hands. So for 20 seconds, you want to turn on the water nice and warm, not hot, not cold, but both warm and make it so it's not too hot and not too cold. And you want to put your hands under the water, get them wet first, get some soap on there, and then you want to rub, 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 not under the water. Outside the water, rub, 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 paying special attention to your fingernails, in between your fingers, the backs of your hands, because germs can live anywhere in any cracks and crevices in there, and you want to do it for 20 seconds. And usually how we time that out is you can sing happy birthday. And then you want to rinse your hands. Then get a paper towel next. Wipe your hands with the paper towel. Make sure they're good and dry, and then use the paper towel to shut off the water. So when I first came in the room, this is a little flashlight that shows you germs. So if you look at the door handle, you can see all those little blue specks. Those are all the germs that are on that door handle. So when I opened that door handle, those germs transferred onto my hand. And there's not very many on there. Oh, there's some. Got some germs there, some germs on that finger, and there. Perfect. And then when I picked up everything over here, transferred germs onto my ball. Maybe we can turn the light off. There's some germs. Germs transferred to the ball. There's some. Did we get any? Oh yeah, here's some on the toilet paper that I touched. My apple. Not too many on there. And my dog toy. Got some there. Ooh, that one's really bright. So now I'm gonna go wash my hands with soap and water. And light. We'll see if I got my hands all clean from the germs. Look at that. All clean. Oh, I missed some. Sometimes even 20 seconds isn't long enough. I missed some germs. That, boys and girls, is how you wash your hands.
Hi kids, I'm Ashley and I'm the ER nurse director at the Brett Hospital, and we are going to talk about the emergency room and how when you would come to the emergency room, and I bet either you have been to the ER or you're, somebody that you know has been to the ER. A lot of people come to the ER for a broken bone, so if you break anything, they come here, we will take a look at you. There's a nurse and a doctor that will take a look at you and will put a cast on you. Or if there's anything that we need to do, we will do that here in the emergency room. Another reason that people would come to the ER is when they're very sick, and we take really good care of them and we get them better. So those are the couple things that we would come to the ER for. In our ER, we do have these machines that kind of tell us, gives a heart rate, it gives a blood pressure, it gives the oxygen level that's in your blood, and we're just gonna go ahead and use a couple things. We're not gonna be able to get a heartbeat, but I can show you how we're gonna hook it up. These little patches, they go on these 3 cords here, and they're really sticky. And when you put them on, they're super cold, but they warm up right away. So we're just gonna put them on like this. Okay, so this helps the nurse and the doctor figure out your heart rate. Now, we don't see anything right now, but we would see a whole bunch of waves going across, and it would give a heart rate number. And that lets us know how your heart's doing. We would also hook you up to this oxygen level. And that number will show up right here, and that will let us know how you're breathing. This is really helpful for when somebody comes in and they're not able to breathe. They're really short of breaths. And this just helps us get a good guide on how they're breathing and what we need to do to help them. And her oxygen level is great. So we're gonna go ahead and take that off. But none of these things that we put on, none of them hurt. They just help us. So we're gonna go ahead, we're gonna take these off. And then we also use a blood pressure cuff. So this blood pressure cuff, it's gonna hug your arm. It's gonna give you a big squeeze. And as long as you keep your arms still and relaxed, it doesn't hurt. The hug does not hurt at all. It might take a while. So a few other things that you would come into the ER for. When you're sick, when you break a bone, when you're short of breath, we've talked about that. When you fall and you break something, like that happens a lot in the older population. When you cut yourself and you come in and you need stitches, the doctors and the nurse will help clean that up, and they'll put stitches in there, or they'll glue your owie together. And we're always open all the time to make sure that everybody has access to us, because it happens at all hours of the night. So the blood pressure cuff it shows us a reading. That's their blood pressure. And right now the blood pressure is great. So that lets us know how your heart is pumping effectively. All right, so that's kind of what we do in the ER when you guys first get here, and then it's not scary, not at all. You'll always have a nurse and a doctor that helps work on you. So if there's any questions, you can always let us know. We're more than happy to help you out.
Hi, my name is Jamie Hagan. I'm the radiology director here at Hancock County Memorial Hospital in Britt, Iowa. And I am with the GHB Cardinal today and the West Hancock Eagle. And we're going to talk about the X-ray department here at the hospital. So to start off, when you come into the radiology department, you may not be feeling well, you may be hurt. You can come in for a number of things. Some of you I've probably already seen, and some of you probably don't want to see me, and that's okay, I understand. It can be scary. Today we are going to be socially distancing. So as we move on with the presentation, I will remove my mask because we will be 6 feet apart. But when you see me in a real life instance, when you're hurt or not feeling well, I will be masked. So I'm going to take the West Hancock Eagle over here. Step, can you step? Up, yep. Now can you turn around? Plop a tail feather up there. So this is my X-ray table. This is my X-ray camera. When you come in, this is what we'll be taking your pictures with. Have lots of uses. We can move it every which way we need to. You can also rotate it this way, rotate it this way. The table is everybody's favorite part because if we need to help the patient stand up, we can do so with the table. I'm going to take you by your wing and I'm going to have you step down. There you have it. We'll go right back over here. Now I'm going to give you another example of taking an X-ray with what we call the chessboard, and this time I'm going to use the GHB Cardinal. I'm going to take you by your wing. I'm going to have you stand and put your back against this board. Good. And in this instance, we'll use this other camera. What we would do is flip it up, shine the light on the cardinal's chest. Where the light shines is where we take the picture. Then there would be a beep, and your chest X-ray is complete. Thank you, Mr. Cardinal. I'll take you by your wing. There you go. That's all we have for the X-ray equipment. So now we're going to look at some X-ray images, and because I'm 6 feet away from those in the room with me, I'm going to go ahead and remove my mask. Okay. The first image we're going to look at, we're going to start at the top of the body and move down. This is your head, your forehead, the back of your head. Down here, you can see some fillings in the patient's teeth. Your jawbone, your sinuses. Some instances where we might have to take an X-ray of your head would be if you fell off of some playground equipment, or maybe a four-wheeler or something like that while you were playing. Next, we'll see a neck. Moving down from your head, there's 7 vertebrae in your neck. They are right here. This is a nice side view, and you can again see your head or your skull, your jawbone, and some fillings in the patient's teeth. Back here on the back of the vertebrae are what we call spinous processes. If you reach back on your neck, and feel. Sometimes you can feel the very end of those spinous processes. Another thing you'll notice is on every x-ray that we do, there is either an L or an R. Those are little lead markers that we use to tell the doctor which side of the patient we are examining, because you have a right arm, a left arm, a right arm, right leg, a left leg, and it's important that they know which leg or which arm we took the picture of, or which side of the body we're looking at. This would be the neck from the front. So again, here, you have your left marker, which means that's on the left side of the patient. The head from a different direction, the 7 vertebrae of the neck moving down. This would be the top of the lungs, moving into the chest. You can see the beginnings of collarbones or clavicles here on your neck. And then down into here, we'll talk a little bit more later about your ribs and lungs. Have some different pictures of hands, wrists, and forearms. This is a broken wrist. Here is your left marker, so that means that's your left wrist. These are the bones of the hand. The bones of the wrist are the little round carpal bones here, and then these are the bones of your lower arm, your radius and your ulna. So we're going to continue to talk about the ways that we fix a broken bone. This again is the screws and plates. In this view you can see the screws very well, and over on the other side is the plate that's holding the brake together. Sometimes after this is repaired, sometimes they will take out the plate and the screws, but bone grows back fairly quickly, and as you get older you might not even know that that bone was broken. Another way that we can repair a broken bone is by using a cast. So in this picture, you can see the bones here in the middle, the bones of the arm, and up here is the bones of the wrists and the hand. And it's hard to determine where the break was here, but all of this extra stuff out here is casting material. And if any of you have ever had a cast or know somebody who has had a cast, casts are very hard, and the purpose of them being hard is to protect you and protect that bone that's broken so that it can take time to heal. So the lighter white out here in the picture is the hard portion of the cast. The gray here in the middle is soft cushion that they put around your bone before they put the hard on. So now we're going to move down into the chest. So this is a chest x-ray. Sometimes you would have a chest x-ray if you have a cough. Sometimes smaller kids will swallow things or put things in their mouth that they're not supposed to, and we would do a chest x-ray to make sure that it's not stuck. Sometimes if you have a fever, we'll do a chest x-ray. But on the chest x-ray, we have the lungs, which are the black on each side. Air shows up as black on x-rays. We also have ribs, which are the white curvy things here that I'm pointing at. Your ribs on your body, if you stop and think about it, would be where maybe mom or dad tickle you. But you have the ribs on both sides. The big white kind of circular swirly thing here in the middle, that's your heart. And the heart is a muscle, so it shows up as white because it's denser tissue. It's about the size of your fist, and it's right usually in the middle to the left side of your chest. Next, we'll move down into the back. Your backbones of your lower back, and also the tops of your hips, which you can feel if you touch your sides. So there's actually 5 vertebrae in your lower back. 1, 2, 3, 4, 5. So that's from the front. And this would be a picture from the side. Again, a left to show that the patient's laying on their left side, And there's 1, 2, 3, 4, 5 vertebrae. Now, if you will remember when we talked about the neck, on the back of the neck were what we called spinous processes. And that's what, if you reached up and felt on the back of your neck, you could feel. The lower back has these as well. They look kind of like squares here on the picture. But if you push on your back in the middle, you can feel those as well. These would be legs. And again, the tops of your hips. So what we call a femur. And if you'll notice, this is a younger person. You can see little additional lines here and here and even down here. These are called growth plates. And as you grow and get older and bigger, those little spaces will close up, and that's how we know you're done growing. And a picture of a knee. Right in the middle here, the little circle, is your kneecap, which that's if you feel your knee, you can feel it when you straighten and bend your knee. 2 bones in the lower leg. We move down to an ankle. The 2 bones in the lower leg come down and meet up with your foot and make your ankle joint. Does everybody know where their ankle is? So then we have a side view of the ankle. This is a little easier to see. This is the heel of your foot. And these are the bones of your foot. And they come together with the lower leg bones to make the ankle. The same thing as we looked at with an ankle when it's broken. There's a broken ankle, pretty badly broken. Well, it's a lower leg actually, excuse me. But both bones of the leg are broken. You can kind of see the zipper here. That's just a device that they use to help support the bone until it can get fixed. Lastly, we have a foot. This is the front view of the foot. So you can see the 5 bones, 5 toes, and then back here from the front is the heel. And on top of that are the 2 lower bones of the leg. Now, some special x-rays that we do here in the department. These are sometimes favorites for people to look at. This one first. This is a x-ray of the lower back and belly. So you'll see the tops of the hips that we talked about earlier. And then if you look closely, there's another spine and a head and some legs and arms. This is a mother with a baby in her tummy. It's pretty neat. Even cooler yet is this picture. Same thing with the spine and hips. But then we have 2 additional spines. 1 here, 4 legs, 4 arms, and 2 heads. So 2 babies. The last pictures we'll look at, we have a veterinarian here in town that has an x-ray camera in his office, but he brings them to us to develop. See here, even cats and dogs have x-rays. And believe it or not, their bodies are pretty similar to what we have as humans. They have spines and lungs and ribs and necks and arms and legs. And if we flip it this way, there's the heart in the cat as well. And the little hips and pelvis. And then the last x-ray is another from the vet. And this is actually a dog. You can tell by the long big tail and the back legs of the dog and the hips and pelvis. That's all the images I have for you today. If you have any questions, don't ever be afraid to ask. We'll be happy to answer. Thank you.
So in your guys' kits, you should have received something that kind of looks like this. I think we used pencils, so there are some lines that are just very faint. And then kind of a little bag full of cut up Q-tips. Something you guys might need to get from home would either be glue or tape. Today I'm gonna use glue. So the activity is, what you're gonna do is you're gonna dump your bag of Q-tips out and you gotta sort through the bones. That's what these kind of represent. So what you're gonna do is you're gonna find the longer ones and kind of glue those down just like that. So here are my two longest ones and those go right there, like where the bones would be. And then you have these little small ones. So you're just gonna kind of glue all around there. And that represents the wrist. So these represent the little bones that are in your wrist. So you're kind of making an x-ray of what you would see. Then after you're done with the wrist, you're gonna kind of move on to the fingers. So looking at your hand, it kind of looks the same, right? Kind of glue some of those kind of in the size that they look. Like you wouldn't take this one to put there, for example. You might want to take the bigger one. And there you have it. There's your skeleton.